Hey, it's Dr. Shaw here. So I wanted to show you how you can prepare your #finishing school. It's this little product right here. And what it is it's 60 weeks of an at-home chemical peel. I had it designed when my teenage children were getting acne and they were having acne lesions, hyperpigmentation, and scarring. And so what this basically is, to keep it real simple, it's a combination of a 30% salicylic acid chemical peel. And what that does is the salicylic acid is basically super aspirin, and it calms down the lesions on your face and starts getting those acne pimples to calm down and settle down and becoming less inflammatory. Then it has a series of chemical peel acids in it that are mid-depth, like a TCA and a few other chemical peels that basically help resurface the skin over time and calm down the browns and the skin irregularities in terms of color and pigment. So essentially, you'll get this little container here. It comes in a tub like this, or a cylinder like this. This is where the chemical peel is, and this goes into the tub. And there's 60 little circular pads in here. So what you essentially do is break the seal on this bottle, pour this over the pads, and let it sit in your refrigerator, turning it over once a day for a few days until it's fully soaked in. And then essentially, imagine there's a pad in here. You'll take a pad and you'll wash your face at night. And once a week, I usually recommend on Sundays, you'll essentially do one pass of your face, and you can do a slight pass on your neck. And then for the first application, you will wash it off in 15 minutes. You're gonna watch yourself over the next week and see how your skin responds. If you don't really have too much peeling, don't have too much inflammation or pain, then the next week you up that dwell time to 30 minutes. Basically, every week after that, you double the dwell time. So first week is 15 minutes, second week is 30 minutes, 1 hour, 2 hours, 4 hours, and 8 hours. When you get to 8 hours, you're basically sleeping in this chemical peel overnight once a week. No matter where you get to, so let's say as far as you can get to 4 hours, and then that week afterwards is a bit of hell. That's fine, that's your number. With time, as your skin gets hardier, stronger, you may be able to boost to 8 hours, but it doesn't matter. The goal is to get to 8 hours if you can, but don't push it if your skin's not happy with it. But over time, and like I said, this is 60 weeks, over a year of treatment, you'll get brighter skin, smoother skin, more reflective skin. You'll get a better even texturization because of the chemical peel. You get better colorization because of the chemical peel and the bleaching. And of course, because you've been every week hitting yourself with a pretty high dose salicylic acid, those lesions that are coming from chronic inflammation, they will start settling down, and you'll notice you may have, less outbreaks, fewer pimples per outbreak, and a quicker recovery time in between. Obviously, you can certainly combine this with other dermatologic care with a dermatologist or over-the-counter or store-bought brands, but just be careful, watch your skin, and you should get an amazing outcome with #finishing school.